Casey.
Hey, Grace. How are you?
Good. I just feel like we need to kind of talk to everybody out there that's listening and kind of share a little bit about what we're doing. We're going to be talking to trans and non-binary youth today.
Yeah, it's really exciting. We're going to provide resources, and there's a lot going on, and we want to let our listeners know what's happening.
Yeah. My name's Grace O'Connor. I'm Vice President and a licensed marriage and family therapist at Gender Wellness of Los Angeles.
And I'm Casey Weitzman, President and Founder of Gender Wellness of Los Angeles.
I was just reading an article today that the American Psychological Association has adopted a landmark policy affirming evidence-based care for transgender, gender diverse, and non-binary children. And they're saying that recent legislative attempts to obstruct access to medical care for trans folks, it puts them at risk for depression, anxiety, and other mental health outcomes. That's from the American Psychological Association.
Which isn't very encouraging, isn't it?
Very, very encouraging.
Yeah, because we always hear a lot of just really terrible statistics.
Yes. There's a lot of negative press coming towards the trans and non-binary population right now. I think there's been a lot of tragedies in the news recently with Next Benedict in Oklahoma. We've been paying attention to that. I know that my clients have been feeling the trauma and grief around that. I'm sure you've been needing to hold a lot for your clients as well.
Well, for sure, because many of them don't feel hopeful about the future or even life after high school or college, and then certainly being trans and non-binary, it also can complicate it more.
It can. And there's vicarious trauma, which is when something happens from a demographic that you're a part of, a culture that you're a part of, that happens to someone within your culture. You also experience that trauma, maybe not to the same degree, but there is vicarious trauma. So lots of resources out there. And I know Casey and I have been doing a lot. We're seeing clients, we're starting groups. We're super excited to be having licensed professionals and associates join our team. We're interviewing right now for new associates and new licensed professionals. Casey and I were just having an amazing conversation about opening up spaces in Sherman Oaks, California this year. Can you share about that, Casey?
We're really hoping to be back in a brick and mortar and have new blood, new assistants, associates, and licensed folks to help gender wellness even get to another level, but in a place where a space where people can come and feel loved and supported, do their therapy, but also lots of family groups, and make it all inclusive, and also try and run some free kind of rep groups so that we can just kind of get a sense of what our young people are going through. And as far as like hotlines and stuff, I think it's always important to remind people, young people, that there's always the Trevor Project, Trans Lifeline, Q Chat Space, PFLAG, and then the LGBT National Helpline. So there are services out there.
And I think the main thing, Casey and I, the reason why we're doing this today is we want everybody to know that you're not alone. I know it may feel like you're alone sometimes, but you're not. There are people out there that want to help. There's organizations that are available to you. So find those resources. Go to the genwell.org page. Go to our resource page, and you can find hundreds of resources. Anything you need to help find the support you need.
And we want to be there and support you and your parents.
That's right. And we're so looking forward to being of service in 2024.